So hey guys, welcome back to my another video. So today we are going to discuss what is the second wave of corona and how it causes the spike. So according to me, human behavior is the major factor. State and local governments as well as individual people differ in their response to the pandemic. Some people follow precautions related to COVID-19 such as social distancing, washing hands and wearing masks. Others are not prescriptive, require these measures, or restrict certain high risk activities. In some cities, towns, and communities, public places are closed or are following boundaries, such as how many people are allowed inside at a time. Others are working normally. Some governments and community leaders encourage or even mandate the wearing of masks and physical distancing. In public areas, others it is matter or personal preference. However, the connection between those precautions and case of COVID-19 is clear. In areas where fewer people are wearing masks and more people gather indoors to eat, drink, follow religion practices, celebrate and socialize. Even family matters are going on shine. Also, places where people live or work together, multi-generational homes, long-term care facilities, prisons, and certain types of businesses have also tended to see greater spread of the coronavirus. Outbreak of the coronavirus occur in the nursing home and super spreader event, gathering of people when infected people transmits the virus or to many others continue to occur. So here we are in another questions of this virus. So many people thinks that more testing is having the more coronavirus cases. So let's discuss on this. That according to me, no. During a surge, the actual number of people getting sick with the coronavirus is increasing. We know this because in addition of positive COVID-19 tests, the number of symptomatic people, hospitalization, and later deaths follow the same pattern. So this can't be the reason that due to more testing there are many coronavirus cases are shown. So and another question is that the reopening and coronavirus spikes. So what should be that unlocking this means? So as communities begin to reopen bars, restaurants and stores during the spring and summer of 2020, people were understandably eager to able to go out and resume some of their regular activities. But the number of people infected with the coronavirus was still high in many areas, and transmission of the virus was easily rekindled. Once people increased their activities and contact with each other, medical experts urged reopening communities to continue diligent COVID-19 precautions, including physical distancing, hand washing, and mask wearing, and monitoring for symptoms. Unfortunately, the combination of reopening and lapse in these infections prevention efforts has caused the number of coronavirus infection to rise again. So, this was about the unlocking. So here we are under question the tracking coronavirus surges. So what track the coronavirus surge? So there is a delay between a policy change such as reopening business or relaxing occupancy limits in a community and when the effects of this change show up in the COVID-19 data. An increase in the number of COVID-19 cases or hospitalization will not be seen a week or even 2 weeks later. It seems to take much longer, perhaps as many 6 to 8 weeks for effects of a policy or widespread behavior change to appear in the population level data. When a person is exposed to the coronavirus, it can take up to 2 weeks before they become sick enough to go to the doctor, get tested and have their case counted in the data. It takes even more time to additional people to become after being exposed to the person and so on. Several cycles of infection must occur before a noticeable increase shows in the data that public health officials use to track the pandemic. So, when an area lacks precautions, the effects of the chance will take a month or more to be seen, of course. Search also depend on the behaviors of people. When they start moving around more, if everyone continues to wear masks, wash their hands, and practice social distancing, reopening will have a much lower impact on transmission of virus than in communities where people do not continue these safety precautions on a widespread basis. In the beginning of the pandemic, some people wondered, will the coronavirus go away in the summer? Unfortunately, a substantial spike during the hot summer months in the US made it clear that this was not the case. Other respiratory illnesses like colds and influenza are more common in the colder months. Now that fall is here, we are seeing a dramatic increase in COVID-19 across the US. In colder moments, people gather indoor, and this is a risk for further transmission of the virus. When the coronavirus first appeared in the US in early 2020, it started with a very similar number of infected people, so it took longer to spread. Now that the disease is widely distributed, with many unknown coronavirus carriers in many different areas of the country, the risk of transmission is widespread. Fall and winter in the northern hemisphere means inclement weather in many areas, with more people spending time indoors. Several holidays take place around the end of the calendar year, and people who celebrate them want to gather, travel, and visit friends and family. Also, after many months of canceling activities, economic challenges, and stress, people are frustrated and tired of talking coronavirus precautions. All these are factors that driving surges and spikes in COVID-19 cases throughout the world. So that's all for today. I will give other information in my next video, so stay safe and stay home. And please try to maintain social distancing and wear masks in every public place.
Like a Hellcat.